Well, let's shift to the lower limb now and see the most proximal joint in that region, the hip joint. The hip joint consists of the femoral head articulating with the acetabulum of the hip bone. This is very similar in a lot of ways to the ball and socket joint of the shoulder. However, the main difference between the shoulder and the hip is that the hip joint is much deeper and more stable. Let's first take a look at how the ligaments are disposed around the hip joint. These ligaments are thickenings of the fibrous capsules and are named based on the part of the hip bone, so the ischium, ilium, or pubis, from which they arise. So there's the ischiofemoral ligament posteriorly, the iliofemoral and pubofemoral ligaments anteriorly. All of them spiral around the joint. This is because as the fetus grows, the lower limb rotates forward so that they're in a position to eventually stand. This spiral arrangement also offers tremendous amount of strength and stability to the joint while still providing a wide range of motion. In this image, you can see another labrum, similar to the one in the shoulder. This one is called the acetabular labrum as it surrounds the acetabulum and it deepens the socket for the femoral head. The ligament of the head attaches to the center of the head of the acetabulum and is important because it carries blood to the femoral head of newborns. It also helps stabilize the hip for people of all ages. As with other joints, there are several muscles that support the hip joint. One particularly important muscle is the iliopsoas, made up of the psoas major and the iliacus. If you've ever been to treatment for a bad hip, the physio or massage therapist may work on this muscle just below the hip bone along the proximal femur. This area can be very tender and tight in a lot of people and can cause significant hip issues if damaged. Maybe you don't have an injury in that muscle, but if you've ever done yoga, you can also feel a stretch in those hip flexors during the sleeping hero pose. We'll cover all these muscles in much more depth in another lecture, but it's good to start thinking about the interplay of muscles and joints that allow movements within the body. On this slide, you can see that there's also a very large and strong group of muscles called the gluteal muscles that help stabilize the hip joint. As you can see here, the proximal femur is almost completely surrounded by the strong muscles that stabilize this joint. In another lecture, we'll talk about the exercises and movements to help strengthen these muscles to provide even more stability to the hip. This is a summary slide of the features of the hip joint. Now, if you learn the details of these structures, you'll understand why it's considered such a stable joint. It's classified as a synovial joint, and it's a deep ball and socket joint with the ball fitting very snugly into the socket. The acetabulum is deepened by the acetabular labrum. The fibrous capsule is thickened to form the ligaments that provide stability, and there is an extra ligament within the socket. Muscles around the hip contribute to its stability as well. These features result in a very stable joint that is still very mobile. These two AP X-rays of the hip show that the femoral head always has lots of contact with the acetabulum no matter what position it's in, so you can understand now why it's so stable. Although flexibility of a joint is mostly dictated by our ligaments, flexibility training and strengthening of our muscles can enable us to access even greater range of motion. When it comes to trauma, we'll first look at hip dislocation. This can easily happen in motor vehicle accidents, also called MVAs. You have probably seen this many times. Somebody really tall sits in the front seat of a small car and their knees are up against the dash. Well, if there's an accident, the force would go directly through their knees and would push their femur posteriorly with such force it could be dislocated. If you outline the femoral head in the acetabulum, the head is completely out of the socket. You can also likely appreciate that another structure can get fractured during this injury, and that's the acetabulum itself, as the femoral head strikes it when it's pushed backwards. Now, we should also look at hip fractures. And there's been an interesting philosophical debate among people about what occurs first, especially since the fracture is most common in postmenopausal women due to osteoporosis and decreased bone density. So, does the fracture occur and then the individual falls, or does the individual fall and then the fracture occur? The elderly are actually at very serious risk for this type of injury, and it can have quite severe consequences for them if mobility can't be regained. Hip fractures can also occur in motor vehicle accidents or sports. Specifically, there are two fractures listed here. First, there's a fracture of the femoral head. The femoral neck connects the femoral shaft with the femoral head. This occurs because the neck of the femur is weaker than the body of the femur, so the break occurs there much more frequently. The second type of fracture is an intertrochanteric fracture. A fracture occurs between the two trochanters of the femur. There's also points where the muscles of the thigh and the hip attach, so these can be under tremendous tension during traumatic falls or when they're exposed to force.